I think my life was probably comparative to any other normal adolescent teen from this area. But I started using drugs and alcohol when I was about 12 years old. By the time I was 17 years old, I had used a bunch of different kinds of substances. I guess what ended up happening for me was going to the hospital and being seen at the hospital for a meth overdose.
I grew up in Normandy Park. I basically got really hard into drugs and alcohol around 15, 16. I was totally 100% spiritually, physically, emotionally just bankrupt. You know, I had nothing left to give, and I was in a really, really, really dark place.
I ended up getting seen by a social worker who was at the hospital, and that person met with my family, talked with me. I really had no idea of what exactly was going to happen. I'd lied to them, trying to manipulate and find a way to not have to go to inpatient treatment, because I think I was really scared of what it would be like there and being away from home and not seeing my problem as serious as it really was at the time.
Folks come to us at a very difficult point in their life. There is a lot of fear, there is a lot of confusion, and there is a lot of anger. And the fact that our folks can assess what's going on, that can create a treatment plan that offers a solution, a way away from the pain, away from the trouble, away from the drama. We have outpatient centers from Tacoma up to Everett, and our residential centers are in Burien and in Kirkland. The idea is there that somebody can be helped close to home.
The staff at Lakeside Milam is exactly like the people who are on the other end of the phone, except at a different point in time. The vast majority of our staff are in recovery. They have been where you are. They know where you live. They will surround you with knowledge and support and love, and will lead you through this process that they themselves have actually experienced.
We've never wavered from our philosophy from day one. We believe that addiction is a disease and that we are treating sick people that need to get well, not bad people that need to get good.
I'm a recovering alcoholic and drug addict myself. As a result of my own recovery, I certainly had some interest in helping other people out of the dark place that I had been.
The associate counselors and the staff that were there while I was in treatment were so amazing that I wanted to do what it was that they were doing. And so I made the decision while I was in treatment that I was going to come back and work for Lakeside.
When people have drug and alcohol problems, they usually don't get better on their own. If that was the case, if someone had a drug and alcohol problem and it was easy as just turning off a light switch and it would be better, they would have already done that.
Alcoholism or drug addiction is a true medical illness. It's the same as if you had hypertension or diabetes or renal failure.
Time and time again, researchers will talk about the #1 clinical determinant of outcome is the relationship that somebody develops with their counselor.
Part of it is you just listen. I don't know that people always want you to give them the answer right away. I think that there's something to be said for being able to help somebody find their truth. I mean, I really want to know what that person's going through and understand where they're coming from so that I can really know them, because I don't think there's a point in giving anybody suggestions if you don't really know who they are.
We have people working with us that are 17. We have people that are working with us in their 70s. We can connect with patients like nobody else can, and we're going to be here.
We're a very professional company. One of the things that I really like about Lakeside Milam is that it's a company that's built on strong principles. We have very strong policies and procedures that are adhered to.
The things that we do are well tested and are backed up by research, with the National Institute of Drug Abuse and all the organizations that we affiliate ourselves with.
And so Lakeside Milam really has a strong philosophy to keep it focused on, this is a disease, let's keep focusing on the disease. Yep, everybody's got other problems. Only somebody who is an addict or an alcoholic would ever drink or use drugs over those other problems once the alcohol and drugs have caused significant problems. That last little piece is what gets most people messed up, because they keep getting sucked into, well, they're using because of this other stuff. And it's like, no, if their brain was working right, their brain would be going for a positive, new, good solution.
Probably the most exciting thing that has happened to our field is the advancements in the study of the brain. And understanding that parts of the brain regenerate provide the opportunity for the individual that is desperate, that is full of fear, that there is hope, not only for recovering, that some of their relationships may heal and their place in society may be regained, but their brain and their body is going to heal. And that is freeing and serves as the catalyst for people to move forward.
If I go back to situations that I experienced in treatment, being away from home and being faced with really, almost a task that feels impossible.
Coming in, I was scared, like anybody else. I was feeling really hopeless, and like dark is how I could explain it in one word. I was just feeling that I was the end of my rope. It was almost like a family, like motherly, like they just take you under their wing, and make you feel really, really, really comfortable.
What I saw from the staff when I was in treatment were people that were always there if I needed to talk to somebody. People were really comforting. They had a great way of being able to notice when you do the right things and focus on those, I think, which can be really helpful for somebody. I never felt like there wasn't enough time for me. I always felt like I was important. I really think that you have a group of people that love the work that they do and have dedicated large portions of their life towards helping an alcoholic or addict get into recovery and have maybe the life that they've always dreamed of having.
Allow yourself to have an evaluation by someone who is knowledgeable and experienced in this field. It will give you the knowledge that you need to make the next step. This is an eminently treatable disease.